Welcome back. Now, blood banks are running low and there's quite a big demand for donors. The Blood Service says the new COVID-19 variant is placing quite a huge strain on supply. At least 3,000 donors are needed daily. So let's talk more about this with the service's medical director, Dr. Karin from Berg. Doc, thank you for your time and good morning to you. I mean, what has been the impact of COVID-19, just in terms of the demand and supply of blood in South Africa?
COVID-19 has completely disrupted both the demand and the supply chain side of the SANPA's business model. We have previously been able to go to schools and universities quite easily and to big corporates where a lot of our blood came from. And so you can imagine the schools are not allowing us back properly yet. We are not really allowed on the university campuses. And for the big corporates, most people who can now work from home. So our usual business model of collecting blood has, in part, almost been completely destroyed. And that has placed a significant burden on our staff and on our donors. On the demand side, what has happened is that our usual patterns of seasonal demand has completely changed. And so during COVID peaks, the demand for blood falls away a lot, up to 20%. But then the moment the hospital bed starts opening up again, the demand just explodes. And because we're not able to build up a year's supply of blood because it has a very short shelf life, we really struggle. And so this period where we are at now really is a big challenge for us because we're coming out of a wave, hospital beds are opening up, just can't get to the donors.
Yeah, and you have the new variants as well posing a challenge. And I'm also tempted to ask, besides COVID, to what extent did the recent unrest also cause a bit of, commotion and pressure then as far as the SA National Bank Service is concerned?
For us, it was devastating. We had just opened up this beautiful, beautiful campus in Mount Edgecombe near Phoenix. And we had to close down that campus completely. We had several of our blood donor collection sites looted. But more importantly, our big testing labs, we have 2 hubs of testing in South Africa, and Mount Edgecombe is one of them. And so we had literally a day of reagents left out of the country. We had to airlift. The blood services had to charter a plane to get into Durban to get our reagents and other consumables out for the rest of the country. So it has been a dramatic year.
Yeah, and just apologies, they said the SA National Bank Service, I meant to say the blood services, SA National Blood Services. Let's also talk about, Doc, then what needs to be done. What are you looking at? Because my research tells me that you need at least over 3,000 donors, at least daily. Is that the correct estimation of at least how far you need to go in terms of making sure that you do have adequate blood, in your care?
Yes, what we kind of plan for every day is about 3,000 units. But at the moment, this new variant has contributed in part to more fears. The hospitalization of patients has been ongoing. And so we haven't been able to meet that 3,000 mark daily, which means that we're falling behind all of the time. And so now, every day that we don't make 3,000, the next day the tally goes up. And so at the moment, we are sitting at a point where we really need about 3,500 units a day. And so we are really calling on every possible person out there who is fit and healthy to come and donate.
Right. And how far are you doing right now with the blood drives? I know that your staff, your SANBS staff, are following strict COVID regulations and, those measures to ensure that they do examine volunteers, that they are healthy, that they do meet the requirements. So how are those drives doing so far?
I think it's sometimes quite surprising for people to understand how sophisticated a logistics business the South African National Blood Service is. And so, we have systems in place to track exactly where our people go. We have a schedule that is worked out 6 weeks in advance. We know exactly when we're going where, and we use historical data to be able to estimate how many units we will be collecting at a particular clinic. And what we have seen is that we are on average collecting about 20% or about 20% fewer people present to donate at a clinic than what used to present historically.
Right.
And so that for us is causing a lot of problems.
Yeah, so the message there being that save a life, go donate some blood, go out there, volunteer. And of course, there's a friendly SNBS staff member there waiting to assist you. Thank you so much, Dr. Karin van den Berg, for joining us from the South African National Blood Service.